Everybody, this is Dr. Forth, and today I'm actually going over masking and how that can be effective in helping to prevent the spread of disease. Now, this was really controversial because some people really dislike wearing masks, and so I wanted to address some of the objections and explain how it actually works. One of the important factors in determining whether or not a disease is spreading is in fact, the dose number of pathogens. In other words, how many particles of the virus are you actually being exposed to? And so this is something that can be addressed with the use of the mask because it does reduce transmission. Now, even the most fabulous, perfectly fitted N95 mask doesn't completely block everything. That is true. Some particles are still going to get through or around, but you greatly reduce the transmission of particles. And so that's why the mask can still be effective. And even though the viruses are very, very tiny, much smaller than bacteria, they don't tend to travel by themselves. They're usually in some kind of body fluid. So either droplets or aerosols. Aerosols are kind of like a gas as a good description. And droplets, think like raindrops. These are bigger and heavier. Okay, so viruses can spread both ways, but it's not these tiny, tiny viruses just floating around by themselves. So the mask, a properly fitted mask, can actually reduce the transmission. And so you want to make sure that you bend the nose piece so that it fits over your nose. It needs to cover both nose and mouth because you're releasing particles and taking in air both in the nose and mouth. There was an article in Nature, actually, October 2020, talked about different kinds of masks, surgical masks, and properly constructed fabric masks, meaning multi layers and so forth. They can actually reduce aerosols, which are the tiniest, tiniest particles, by about 67%. And N95 masks reduce about 90% of aerosols. And so they're really pretty effective. Masks with a vent, you've probably seen those. They have the little plastic uh, part in the mask. Those and the fabric neck gaiters that people just pull up over their face are explicitly ineffective. In fact, they can actually contribute to greater amount of aerosol formation. Clear face shields, you've probably seen like the headband with the plastic part, not effective because it's not actually covering the nose and mouth, and the particles just go around that shield. All of this means that wearing the mask is going to help reduce the particle transmission, both the amount that you are exhaling and how many particles you're actually taking in. So remember that the masks have to cover nose and mouth. And we do have some particular different notes when we talk about children and masking. The literature is generally in agreement that very young children, 2 to 3 years of age or younger, should not be masked due to risk of suffocation. The American Academy of Pediatrics and the Italian Pediatric Society specifically have come out with statements about this. Children under the age of 2 should not be masked. And according to the Italian Pediatric Society, that age is 3. So good idea to check with your particular pediatrician if you have young children and you're not sure exactly where the cutoff is for that to be safe for them. Some of the objections people have about masking, well, masks can decrease the blood levels of oxygen and increase carbon dioxide levels. That's not really true. There's no evidence of this, and they've actually done studies with masked individuals wearing pulse oximeters to measure this and see if that's the case. And you can even check that for yourself. I saw on online retailers pulse oximeters really pretty inexpensively. If you don't know what that is, it's the little thing they put usually over the finger, and it has a little red light, and then it gives a reading of how much your blood is actually oxygenated. So you can find those very inexpensively, and you could test that for yourself to see that that's true. Viral particles are way too small to be blocked by a mask, so wearing a mask is just like trying to stop mosquitoes with a chicken wire fence. Yes, I heard that exact thing on social media. We already talked about how viruses don't travel by themselves. They're in droplets or in aerosols, and we know that masks cannot 100% block. That's absolutely true. They cannot 100% block the passage of these droplets and aerosols. But as I said before, part of determining whether or not people get sick is related to the number of viruses to which they are exposed. So if we reduce the number, and think about this, if you're wearing a mask, other people are wearing a mask, then the amount of material you are putting out is going to be reduced. And also, the amount of virus that you may potentially be taking in is reduced. So that can help reduce the numbers. Another objection, my friend contracted the virus even though they were wearing a mask. Yes, that's certainly possible, but reducing the amount of virus that's being released and taken in by the person who's wearing the mask definitely helps to decrease the chances of getting sick. Masking decreases the immune system activity. It's like living in a bubble, so my immune system is going to get weakened. No, the immune system is always getting exposed to things in the environment. By putting a mask on, you're certainly not in a sterile environment devoid of all potential pathogens. Your immune system is still going to be exposed. And so wearing masks does not damage the immunity. This can be an effective way to reduce the spread of illness. And so think about that if you are ill and you have to go out. You might wear a mask to reduce the amount that you are exposing other people. Or if you are immunocompromised or you live in a household with someone who is immunocompromised, wearing a mask is an excellent way to reduce the amount of exposure. Just some things to think about.